Hi guys! So the purpose of my video is to inform everyone about communication in healthcare and how it affects daily living and what you have to go through when you go to the hospital. So would you want a nurse that cares for you, or do you want a nurse that kind of just comes in and checks on you every couple hours and doesn't really take care of you? I don't think so. I've seen it firsthand that some nurses don't care about the patient, they just are there for a paycheck, really. So I'm going to show you a little video from my visual aid to kind of show you what verbal and nonverbal kind of looks like in the hospital.
Here are examples of non-therapeutic techniques.
Hi, I'm your nurse today. Why are you crying?
I found a lump in my breast.
Okay, why? Do you know why?
It could be breast cancer.
It could be breast cancer. Well, have you been doing yourself breast examinations?
Not like I should.
Not like you should. Well, you don't even know yet if you have it. So, how about you? I'll just get your bottles. Hey, can you come get her bottles? Tashara!
Huh?
Come get her bottles.
Hold on.
She's coming.
Girl, come right there. Come. Girl, what's wrong with you?
I found a lump in my breast.
I'm not trying to do it. I need to do what now?
She said you were gonna do my vitals.
No, Tim. She alright. Where's your blood pressure? I don't even think that's the right size, but it'll be alright. Let's see your arm.
Now, can we do it on the other arm?
That don't matter what all we're doing on. It's gonna be okay.
Can we do it on the other?
Girl, stop crying. My dog died yesterday, so I shouldn't be crying. I'm gonna cry. Well, it didn't take, but 120 over 80, that sounds good to me. Let's
Can I have
go.
a blanket?
Hold on. See you later.
Here are examples.
Okay, so in this video you see that the nurse isn't really caring for the patient. They're kind of just coming in and out of the room, not caring what the patient wants, and just really not listening to the needs of the patient. That's really a lack of communication, and that's not okay. Because the patient is always right, and they're there to be cared for, and this is an example of something that is not okay. So my name is Brittany. I work in the healthcare field. I've worked in a hospital for 4 years now. And it's really important to establish rapport between patients and nurses or nurse assistants or doctors, because you want your patient to trust you and feel comfortable enough to tell you everything that they're feeling and what's going on so they get the best care. So you may wonder why you need to know this. One day you may be a patient, you may have a family member that's hospitalized, and you wouldn't want your family member to be treated a way that you wouldn't want to be treated. So someday you're going to be a patient, whether it's having a baby or if you're sick, family member sick, and you really want communication to know what's going on in that person's life. So today I'll explain a couple ways of communicating in the healthcare field. The first that I'm going to talk about is the communication. So there's verbal and nonverbal. And so verbal thing that I looked up was, according to Cancer Nursing, the relationship and communication between patients and healthcare professionals in the outpatient setting were important for the patient's ability to cope with cancer. So cancer is something huge in somebody's life, and you want to be able to trust your healthcare professional because your lives are basically in their hands. So you want to be able to get the best care. So that's something that is major for verbal communication, and nonverbal would just be, you want to smile all the time, which I always try to do with my patients. You want to let the patient know that you're there for them and just keep the line of communication open so that you feel comfortable enough to be able to go to your nurse or your nurse assistant. And that's what nurses are for. They're your advocate. So that is one huge thing, is communication. So another thing is documentation. We use PowerChart at work, which is our charting system. And we use that to document different things a patient does throughout the day, whether it's how many times they've gone to the bathroom or how far they've walked, if they've showered. Also, doctors, nurses, social workers, they all document in the chart to show progress that's going on with the patient, whether it was a surgery they just had or maybe if they're going to another facility. So that is one of our things for PowerChart. Our patient daily boards are in each patient's rooms. We have the day, we put some pictures sometimes. The doctor will sometimes draw a picture of the surgery the patient's having done, say it's something in their stomach. The doctor will draw a picture of it so the patient knows what's going on in their body. It also shows maybe the patient wants to shower that day, so their daily goal is to shower. So the nurse will write that on there. They'll write their medications down. They'll write different phone numbers for either me or the nurse, or like maybe respiratory, some other kinds of therapies like occupational therapy. Their numbers will be on there also, maybe family contacts. So that's really something that is important in the healthcare field. What else? So ADLs, that stands for Activities of Daily Living. And it's really important because we get a lot of nursing home patients that come in there, they haven't been bathed in maybe a week. So it's really important for us to get to those for them. Some of them can't feed themselves, so that's what we do for them. A lot of patients are like a 1-to-1 feed, so we have to feed them since they can't do it. Maybe they have a broken arm or 2 broken arms, and sometimes they just can't do those things for themselves anymore. They can't bathe themselves anymore, so we do that for them. So there is something I looked up on malnutrition, which is something major. And according to NCBI, malnutrition in 65 years and older adults is at 62.3% being malnourished after post-acute care. A lot of times when patients get older, they just almost give up and they just don't want to care for themselves anymore, and it's really hard. So we try our best to get those patients whatever they need. So healthcare field is something that everybody uses, whether it's coming into the world or leaving. It's just something that is always needed, whether it's something you need to go see a doctor for, or if you have to be hospitalized for. It's just very important, and communication is always key. So, I mean, if you're hospitalized, wouldn't you want a nurse that cares for you and it's not just there for a paycheck? I know I wouldn't. So that's why I try to always smile and make sure my patients are happy before I leave. So the purpose of this speech was to inform my classmates about the healthcare field, and that's it. Thanks.